Bismillahirrahmanirrahim. Quote of the day. Better than 1,000 days of diligent study is one day with a great teacher. Today, the topic of my presentation is Health Service Delivery System, and I will be presenting it under my supervisor, Professor Dr. Saira Afzal. Learning outlines, health and health system, services in healthcare system, healthcare service delivery in Pakistan, healthcare spending in Pakistan, issues and challenges of the service delivery system, recent advances, and MCQs. Learning objective. At the end of the presentation, participants would be able to describe the services in healthcare service delivery system of Pakistan, its composition, its goals, expectations, and challenges faced by it. What is health and health system? Health, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Health system consists of all the organizations, people, action, and whose purpose is to promote, restore, and maintain health. The services offered by the healthcare system are four, which are as under: preventive, promotive, curative, and rehabilitative services. The curative and rehabilitative services are being provided mainly at the secondary and tertiary care facilities. The preventive and promotive services are mainly provided through various national programs and community health workers interfacing with communities through primary healthcare facilities and outreach activities. Health service delivery in Pakistan. The healthcare delivery system in Pakistan consists of public and private sectors. Under the constitution, health is primarily responsibility of the provincial government, except in federally administered areas. Healthcare delivery has traditionally been jointly administered by the federal and provincial governments, with districts mainly responsible for implementation. Presently, the Ministry of National Regulation and Services plays a key role in the formulation of policies, strategies, setting a vision, and planning. The operationalization of the policies and laws lies on the provincial and local governments. The state provides healthcare through a three-tiered healthcare delivery system and a range of public health interventions. Some government and semi-government organizations like the armed forces, parastatals such as SUI-GAS, WAPDA, Railways, Fauji Foundation, and the Employees Social Security Institution provide healthcare service delivery to their employees and their dependents through their own system. However, these collectively cover about 10% of the population. The private health sector constitutes a diverse group of doctors, nurses, pharmacists, traditional healers, drug vendors, as well as laboratory technicians, shopkeepers, and unqualified practitioners. Government systems in Pakistan: federal government, provincial government, local governments. Federal government. Health policies devised by the federal government, which is implemented by the provincial government. From July 2011, responsibility and resources shifted to the provincial government. From 2014 onwards, local governments have an important role in healthcare delivery system. Provincial Department of Health, which consists of the Ministry and the Secretary Health, which make the policy level decision. Then comes the section officer with support staff and DG Health, which are involved in planning and management. Teaching and training institute like medical colleges, nursing, paramedical training schools. The local government constitutes the district Nazim and deputy commissioner, which are involved in planning, implementation, monitoring, data collection, analysis, interpretation, evaluation. Composition of the health care system. Healthcare system is primarily the responsibility of the provincial government. Each provincial government has Department of Health, which also regulate private healthcare providers. Survey 2005 to 6 indicates that 67.4% households in Pakistan consult health providers in private sector when they have health problems. Other providers are Hakim, homeopath, pharmaceutical, Tabibs. Government sector is low cost. Outpatient department have no consultant fee, but patient has to pay for medicine. Healthcare delivery system of Pakistan. The public and private sector. Public sector is federal government and provincial government, and private sector consists of major hospital, individual practicing GPs, Hakims, homeopath, NGOs. Then comes the provincial government, primary, secondary, tertiary care comes under its umbrella. Then the federal government, which consists of the Ministry of Defense and other ministries and vertical programs. Public sector healthcare system endeavors to deliver healthcare through a three-tiered level healthcare delivery system and a range of public health interventions. Levels of healthcare are primary healthcare, secondary healthcare, and tertiary healthcare. The public sector constitutes the dispensaries. Primary sector consists of the dispensaries, MCHC, BHU, RHC, NGO, community groups, general practitioners, non-formal health providers. The secondary level consists of the clinics, maternity home, tehsil hospitals, privately run hospitals, non-formal health providers. And the tertiary hospital constitutes the large urban private hospital and district hospitals. The public health activities have persistently increased in terms of physical infrastructure and workforce. The national health infrastructure comprises of 1201 hospitals, 5518 basic health units, 683 rural health centers, 5802 dispensaries, 731 maternity and child health centers, and 347 TB centers. The total availability of beds in these health facilities is estimated at 1,23,394. In addition, more than 95,000 lady health workers are providing primary health care services to the community through the health houses. Private sector, the rising population pressure on state health institutions has allowed the private sector to bridge the gap of rising demand and limited public health facilities. A number of private hospitals, clinic, diagnostic labs has increased considerably and is contributing health services in the country. Majority of private sector hospital has sole partnership model of organization. The healthcare spending in Pakistan, the budget of the 2023 and 4 shows the paltry increase in health spending despite unsatisfactory indicators. Even though health indicators remain abysmal as per the data shared by the Economic Survey for the last year, the government has failed to make a significant increase in health spending in the budget for the upcoming fiscal year, inviting criticism from an apex medical organization which demanded health allocations in line with global guidelines. The federal government proposed an allocation of 24.21 billion for the healthcare sector for the financial year 2023 to 4 as compared to 22.49 billion allocated during the outgoing financial year, while the sum of rupees 13 billion would be spent to uplift the sector under the public sector development budget. A major chunk of the health budget would be spent to maintain hospital services, while rupees 3.11 billion would be allocated for the public health services. Goals and expectations. Since the time of independence, healthcare delivery system of Pakistan has undergone major reforms, starting its journey from the national health policy, primary healthcare services, TB control, immunization programs. Regardless of the settled goal and expectation, Pakistan health system showed dissatisfactory progress and failed to achieve desired outcomes. Furthermore, Pakistan failed to achieve goals of health for all in the Alma-Ata Declaration and failed to maintain the Millennium Developmental Goals 2015. Currently, Pakistan is aiming to attain the Sustainable Developmental Goals 2025. In addition, Pakistan has also settled the National Health Vision to improve the health of all population, particularly women and children, through universal access to affordable quality, essential health services, and delivered through resilient and responsive health system. Issues in the healthcare delivery system. The healthcare delivery suffer from some key issues like high population growth, uneven distribution of health professionals, deficient workforce, insufficient funding, and limited access to quality healthcare services. Pakistan health system has an extensive infrastructure spanning the country, but has inadequate resources, that is drugs, instruments, supplies, and technologies. Health system rely a great deal on the health technologies, limited use of information technology. Record maintenance and unfitting infrastructure can be observed in health system of Pakistan. It lacks health management information system in public sector and has no well-defined policy and plans for technology implementation, telemedicine infrastructure development. Moreover, most of the healthcare educational institutions have limited tools and technology to prepare the health professionals. The process of certifying licensing is weak and evaluation of the performance of health profession is not maintained across the country. At the national level, the legislative framework for the health information that covers vital registration and notifiable disease reporting do not exist. However, certain private organizations in the country are well equipped with advanced technology, infrastructure, and health management information systems. Moreover, the concept of e-health has been implemented in the rural areas of Pakistan, for example, Gilgit-Baltistan, with the help of ComStats University and Association of Pakistan Physicians of North America, known as APNA. How to improve the health status of population, promote quality, facilitate choices, control costs, improve access. WHO supports the National Health Authority's vision and aim of reaching universal health coverage through the delivery of equitable and sustainable health services. Support to the delivery of an identified package of essential services that is based on integration of service delivery, introduction of family practice, and promotion of public-private partnership models and service delivery. Quality of services and patient safety as one of the main components of service delivery. Recent advances. District health system capacity to maintain healthcare service delivery in Pakistan during floods, a qualitative study. The study showed that torrential rainfall following the monsoon season occurs annually in Pakistan and adversely affects the healthcare service delivery. The qualitative study was undertaken in 5 flood-prone districts. The first of its kind study to gather an in-depth assessment of the capacity of district health systems in maintaining healthcare service during flood. Key informant interviews were conducted. 9 focus group discussions were also conducted with 56 lady health workers. World Health Organization Health System 6 building blocks framework was utilized to assess the performance of district health system. The findings illustrated increased reporting of diseases and domestic and sexual violence against female. The damaged roads and unavailability of transportation during floods affected outreach services. The inadequate availability of funds resulted in critical gaps in the supply chain for essential medicines, impeding the outreach services. Shortage of female medical staff was reported in addition to poor attention. Furthermore, reporting mechanisms varied across provinces with daily reporting system of acute illnesses. Moreover, district health systems lacked gender-sensitive responses in responding to flood emergency. This study identified multiple health system constraints that resulted in poor district health system capacity in delivering essential healthcare services during floods. Analysis of the healthcare system of Pakistan, lessons learned and way forward. A systematic search of national and international literature was looked from peer-reviewed databases from Medline and PubMed. There is little strength in healthcare delivery system in Pakistan, like making health policies, participating in Millennium Developmental Goals program, initiating vertical programs, introducing public-private partnership, improving human resource development infrastructure by making basic health unit and rural health center. However, these all programs are very limited in its scope. That is the reason that Pakistan healthcare system is still not very efficient. There are numerous weaknesses like poor governance, lack of access, unequal resources, poor quality of health information management system, corruption in the health system, lack of monitoring and health policy and health planning, and lack of trained staff. Pakistan is improving very slowly in the health sector for the last 5 decades, as is evident by the health indicators and above mentioned strengths and weaknesses. Therefore, government needs to take strong initiatives to change the current healthcare system. Telemedicine, a new healthcare delivery system. The resurgence of telemedicine can be attributed to its potential for addressing intransigent problems in the healthcare, including limited accessibility, cost inflammation, and unequal quality. The scope and methodological rigor necessary for sustained development and policy making have been limited in this area of research owing to the nature of extant telemedicine projects and the lack of comprehensive research strategy that specifies the objectives of telemedicine research regarding accessibility, cost, and quality. Research strategies and a framework for analysis are discussed without a commitment to the types of research objectives, framework, and strategy presented. The considerable promise of telemedicine as an innovative system of care may not be fully realized. Now we come to the MCQs. Number 1, in Pakistan, under Article 18th Amendment, the healthcare services are the obligations of which government? A, federal, B, local, C, districts, D, provincial, and E, national.
D.
Yes, D is the right answer. Which one of the following has the potential for addressing the intransigent problems in the healthcare including limited accessibility, uneven quality, and cost inflation? A, BHU and RHCs, B, OPD, C, emergencies of tertiary care, D, telemedicine, or E, Tehsil headquarters?
D.
Yes, D is the right answer. According to WHO, one of the main components of service delivery is A, community participation, B, patient safety and quality of services, C, cost inflation, D, easy access, E, outreach program activities.
A.
It's B, patient safety and quality of services. Presently, which of the following plays a key role in formulation of policy, strategy, setting a vision, and planning? A, section officer, B, support staff, C, Ministry of National Regulations and Services, D, DG Health, E, Deputy Commissioner. Anyone?
B. B.
No, it's C. The ministry has a key role in formulation of policies. Which of the following is involved in planning, implementation, management, interpretation, and evaluation? A, Health Minister, B, Health Secretary, C, Federal Government, D, Section Officer with the support staff, D3, DG Health, E, Paramedics.
D.
Yes, D is the right answer. Pakistan health system showed dissatisfactory progress and failed to achieve desired outcomes. Currently, Pakistan is aiming to achieve which goals in 2025? A, health for all, B, millennium developmental goals, C, TB control program, D, sustainable development goals, E, global health goals.
D.
It's D, sustainable development goals. One of the challenges faced by healthcare delivery system of Pakistan. It lacks health management information system, traditional healers, political conflicts, incompetent doctors, less hospitals.
A.
Yes, A is the right answer. Service delivery is being organized through promotive, preventive, curative, and rehabilitative services. The curative and rehabilitative services are being provided mainly at A, BHU and RHC, B, secondary care, C, tertiary care, D, secondary and tertiary care, E, Hakims and homeopaths.
D. D.
Yes, D is the right answer. Pakistan failed to achieve goals of health for all in Alma Ata Declaration and failed to attain which goals in 2015? A, Sustainable Development Goals, B, Global Health Goals, C, Millennial Development Goals, D, TB Control Program, E, EPI.
A.
No, it's C, Millennium Development Goals. The state provides healthcare through a three-tiered healthcare delivery system and a range of public health interventions. The primary, secondary, and tertiary healthcare setups are regulated under which government? A, federal, B, provincial, C, local, D, autonomous, and E, defense.
B.
Yes, B is the right answer. This is the key of my MCQs. Thank you, everyone. Please like and subscribe to our channel. Should I end the meeting, Dr. Sadia?